For this presentation, we will be analyzing the heroin epidemic in Massachusetts from an epidemiological standpoint, focusing on the who, where, and time of the subgroups who make up this large percentage of deaths per year in our state. Heroin deaths increased sharply in many states, yet the number of confirmed cases of unintentional opioid overdose deaths for Massachusetts in 2014 represents a 65% increase over 2012 and a 21% increase over cases for 2013. It is important to recognize who this is affecting in our state of Massachusetts so that further preventives can be identified. Due to increasing rates of opioid addiction, we are seeing a large percentage of subgroups relinquishing to the drug. This project goes further into the details of the overdoses in this epidemic. When looking at which race is most at risk for a heroin overdose, we found that there was a total of 791 unintentional heroin overdose deaths, accounting for 1.85% of the 42,684 total deaths in the state of Massachusetts. Of those 791 heroin overdoses, we found that 83% were white non-Hispanics, 9% were Hispanic, 5% were black non-Hispanic, 2% other, and the Asian non-Hispanics were at 0%. Suicides are excluded from this chart. Looking at the heroin overdose death rates per age group between January and December of 2015, we found that there was a total of 791 deaths throughout the age group. The highest number of deaths was with the ages 25 to 34 with a total of 247 deaths, followed closely by the age group of 35 to 44-year-olds with 203 deaths, and ages 45 to 54 with 178. The lowest amount of deaths per age group was the 65 and up with a total of 4 deaths. When looking at opioid deaths by gender, data showed between January and September of 2015, there were a total of 791 deaths, 604 were male, with 187 female deaths. This map shows the incident rate of each county in the state between January 2013 through September 2015. The opioid overdose death rate in Bristol and Barnstable counties are the highest in the state, with the incidence rate ranging from 16.3 to 20.2 deaths per 100,000 people. In contrast, Nantucket has the lowest rate with 9.3 deaths per 100,000 people. Worcester County, where the university is located, has a range of 9.4 to 13.6 deaths per 100,000 people. The state rate is 13.9 deaths per 100,000 people. The Massachusetts Department of Public Health analyzed the number of deaths between January 2012 to December 2014. The link in the slide provides the entire list of cities and towns in the state and has the deaths listed from each year. In the year of 2014 alone, there were 87 deaths in Boston, making it the top city with the most deaths overall. Worcester has 42 deaths, Lynn had 38, Fall River had 34, and Lowell had 32. These 5 cities and towns had the highest number of deaths in the state. Interestingly, Boston is part of Suffolk County, which, as the previous slide indicates, had an incident rate of 9.4 to 13.6 deaths. Worcester, though in its county, shares the same incident rate. Lynn is in Essex County, which has an incident rate of 13.7 to 16.2 deaths. Fall River is in Bristol County, which has the highest incident rate in the state with Barnstable County. Lowell is in Middlesex County, which shares an incidence rate with Worcester and Suffolk counties. This line graph indicates the crude rate along a 14-year span in the state. The Massachusetts DPH states that there was a 228% increase of opioid-related deaths from the year 2000 to 2014. In the year 2000, the state had a rate of 5.3 deaths per 100,000 people. This steadily increased until 2014, which had a confirmed death rate of 13.6 per 100,000 people, but an estimated 17.4 deaths per 100,000 people, supporting the 228% 6% increase. This bar graph represents the number of confirmed opioid-related deaths between 2000 and 2014. In the year 2000, there was a total of 338 deaths. Increasing year after year, the deaths began to reach close to 1,000. In 2013, there were 911 deaths, and in 2014, there were a total of 1,099 confirmed deaths, with an estimated additional 61 to 89 deaths, leading to the unofficial grand total of 1,173 deaths for that year. Between June 2014 and September 2015, DPH analysts had confirmed and estimated numbers for opioid-related overdoses per month. The lowest number of deaths in a month was in September 2015, which had a confirmed number of 66 overdoses and an estimated additional number of 46. The highest was in March of 2015, with a confirmed number of 134 overdoses and an estimated additional number of 23. Between the months of January and March 2015, there is a visible peak in the bar chart representing the time period's most confirmed overdoses. In conclusion, based off of the evidence we have compiled and presented on our previous slides, it is evident that the heroin epidemic has taken a major toll on the residents of Massachusetts. In the last 15 years, heroin overdose death has exponentially increased in the state by 228%. Whilst non-Hispanic white males are the highest impacted population groups, heroin overdose does not necessarily discriminate against anyone.